So I'm the Chief Administrative Officer of Behavioral Health Services. So that means I oversee this particularly the acute facility, which is John George, but also across the continuum of behavioral health. Behavioral health for me has always been in both intriguing and I think really complex. The training that really stuck out for me is the knowledge that your mind, body, spirit, the relationship is critical to healing. We see a complicated amalgamation of issues. So, for example, the seasons are colder, evening begins earlier. People take for granted those activities that you can do in the summer or when it's brighter actually help to keep you healthy, walking, even grocery shopping. So when that decreases, if you are in a place where there are other risk factors, it makes your options a little more limited for travel. Obviously, there's what's called seasonal affective disorder, which is a biochemical basis for that, where literally people are very attuned biologically to the seasonal changes and experience more symptoms of depression. Some of the other things that we see is again an increased use of quote self-medicating strategies, which of course could be substance use or smoking, things that aren't healthy for you obviously, that are compounded by the fact that it's the holiday season. Can I make goals for myself today? Can I do one activity where I don't really feel like doing it, but just to push myself to do it? Because just literally the natural endorphins that you produce by walking around or watching your favorite show, going to a movie, eating something that you love, healthy, of course, literally can have effects. So I think when you look at what your bucket list feels like it should be, try to pair that with, can I push myself every day to naturally produce those changes? But if you can just open up and talk and maybe look at other resources, if you're already on certain medications, being mindful with your medical provider or your behavioral health provider about whether it's being as effective. Be mindful of the things that you can control, and again, if you need to, really seek some support around it. If you are one who thinks this may be an issue for you, giving your loved ones or friends permission to kind of say, you're a little irritable today, or you're all right. And if you can give space to people that you trust and you love to kind of help you through, again, it's much easier to deal with because you could say, hey, maybe I am feeling a little bit and I have to do something different.